You are tuning in to McLaren Huron today's health program, and I'm speaking with physical therapist Kurt Brinker in regards to rehab and therapy options for patients that have had joint replacement surgery. Kurt, thanks for joining us today.
Thanks for having me.
Could you tell us a little bit about the seminar that the hospital provides for patients that have had joint replacement surgery?
Yeah, so we started doing an educational seminar for patients who are scheduled for surgery. They'll come in a week to a few weeks out of their surgery, and it's been really great for the patients. They come in and they meet with a nurse that will be on the floor, a physical therapist, and then also a case manager. And we go through everything from that day, giving them exercises to be able to do prepping for the surgery. We talk about things that they can prep their house, making meals before so they have stuff afterward. We'll go through all of that, and then even the day of surgery, what to expect during the hospital stay, and then after the hospital stay, we'll talk about maybe equipment that they may need that they can get before, so that they're all prepared. And we've really seen a big benefit. Patients are much more comfortable when they come in. It gets rid of a lot of anxiety, and they really do a lot better knowing kind of what to do and the expectations that they have. So it's been a really great thing.
So how soon after a patient's had the surgery do they expect to be up and moving?
Well, that's kind of a thing that we've been starting to do too now. We find that patients do much better now. We're getting them up actually the day of surgery. Patients are starting to get up, at least getting to the side of the bed. Some patients are even walking that first day. It really seems to help. They're getting moving before some of that stiffness comes in, because usually that next morning they're going to be stiff. It may be a little more sore, but if they get that confidence of getting up and seeing that they are able to do it right away, they progress much quicker and move and do much better now.
Kurt, could you explain to us what the difference is between inpatient and outpatient therapy?
So in the inpatient side, after the surgery, they come in. Our goals are really to get that patient back home to progress, to be able to do whether it's home care or in an outpatient setting. So our goals are really going to focus on things that they're going to need to do at home, getting in and out of bed safely. We'll work on training them with a walker to learn how to walk safely again with that walker. And then other skills that they may need that's individual to them, whether it's certain bathroom skills depending on how their bathtub may be set up, or some patients have stairs they have to get up to get into the house. And so we'll practice those type of skills to be able to get them back home safely, and then they can progress on that outpatient side or the home care side.
Why would somebody after surgery have to go to a rehab facility?
So some patients, whether they may not have a support system at home, they're by themselves, or maybe they're not quite progressing quite as fast as they'd like while they're in the hospital, there is that rehab facility that they can go to be able to continue to progress, to be able to do those skills safely, to feel comfortable going back home, and really to be able to feel confident and to be able to progress back at home.
Who or what determines whether after surgery somebody goes home or goes to a rehab facility first?
So it's kind of a culmination with everybody, with the patient, with the physical therapist, the doctor, is kind of decides between all of them. The biggest thing is we want that patient to go home confidently and feel safe to be able to kind of continue to progress. And if that's not able to happen right now, there is that rehab side where they can continue to work that to get comfortable. Long term, we've got this new joint. We want you to be able to kind of do the things you want. And if it takes a little bit of time to go to that rehab facility before you get home, that's okay, at least in the long run. You'll be able to do the things you want and be able to use that new joint again.
Well, Kurt, this has been very informative. Thank you so much for joining us today.
Thank you for having us.
This is Sarah Tate reporting from McLaren Huron today's health program.